Thank you very much, Mr. Chairman. Just want to thank Professor Rafat Naga, Dr. Wael Sha'lan, and Dr. Ahmed Naga for their kind invitation. This is something I cannot miss. I'm going to talk about management of iliac artery aneurysms. We all know that it's not that frequent. It's about 7% of the intra-abdominal aneurysms, and mainly common iliac artery. Isolated iliac artery aneurysm are rare, maximum 30% in some studies, usually bilateral in some cases. The presentation is either due to compression or complication. The morphological variants of isolated common iliac artery aneurysm. It can be either fusiform, kinked, or complex, this complex involving the three iliac vessels. The question here, do isolated common iliac artery aneurysm cause aortic remodeling? And the answer is yes. Isolated common iliac artery aneurysm have this effect. It can cause ipsilateral aortic deflection in about 70% of cases. Treatment, either open or endovascular. This study was done and it mentioned that surgical treatment provides good early and mid-term results, but actually this was 2008, 12 years ago. Things have changed now, and we have a lot of technology came in during this 10 or 15 years ago, and this is 2019, the European Institute of Vascular Surgery, these guidelines, and they mentioned that the minimum size for iliac artery aneurysm to be treated is 3.5. The endovascular options depends on the landing zone, whether isolated or with AAA or with internal iliac artery aneurysm, and depends also on the state of the contralateral internal iliac artery. Internal iliac artery sacrifice sometimes has these hazards, buttocks claudication, necrosis, erectile dysfunction, and so on. To do internal iliac artery preservation, we have these techniques, whether this bell bottom technique, sandwich technique, iliac branched device, or homemade grafts. This is the bell bottom technique. This is a closer look when you have the classic size of the stent graft and you put a larger one to supply both internal and external iliacs. This is the sandwich technique where you put two stent grafts, one in the external and one in the internal iliac, and goes directly side by side inside the stent graft coming from the aorta. This is the sandwich technique, and this is the famous now iliac branched device. Why iliac branched device? It's a quicker procedure, avoid healthy aorta recovery. Remember, we are talking about isolated iliac artery aneurysm. So you avoid healthy aorta coverage. Internal branch device to treat isolated iliac artery when it's possible, when you have a common iliac neck and you have the feasibility of the IPD. When it's not possible, when you don't have this neck, or you have short or angulated, these are the results of IPD to treat isolated iliac artery aneurysm. It's reaching 95%. So isolated iliac branch device implants, safe and effective treatment option, and should be actually is number one option. The long-term results, 5 years, are very good. Just some cases This is an iliac artery aneurysm. This is during the procedure, and this is after we cross the aneurysm, and this is after the stent graft was put. This is before and after. This is a very challenging case. We had this case of iliac artery aneurysm with occluded external iliac and femoral, and in an amputated patient. You can see this is the aneurysm, and this is the occluded. There is no external iliac or femoral. These are only collaterals, and the patient is amputated. We had a lot of argument about this case, what to do, whether surgical, whether endovascular, and if endovascular, are we going to, for example, recanalize the femoral from this side and put stent graft, or come from the other side and put coil or a plug. But actually, this is what we did. We did aorto-uni-iliac, and then we did femoro-femoral. Also, this femoro-femoral, we had a lot of discussion and debate whether to do it or not, because the patient is amputated, and we had very successful result. But actually, it was too much successful. There was no single collateral appeared after this angio, so I was very much afraid to lose the stump, and we did this femoral. This is just a case of pseudoaneurysm in a child. It's just with fractured pelvis, and this was done surgically. In conclusion, endovascular approach is with the new advancing techniques is now the #1 option, and surgery still have its role. Thank you very much.